What is a positive mental attitude? When is it helpful? But when does it potentially become toxic? When does it become unhelpful, and why? Hello, I'm Rodger Duckworth, and for the last 30 years, I've helped people at the edge of despair overcome, not just manage, their chronic illnesses and conditions. There is a lot of talk about positivity on the internet, and I'm not saying that it's all bad, but I have fallen foul of this in part of my own search to heal and to explore the power of the mind. And it is certainly a very powerful thing. If we dwell, then yes, of course, cognitive impact will shape the way we feel. It will have a descending effect down through the brain to have an impact down into then the physiology in the body. There's no doubt about that. However, one of the biggest problems is that if there are unconscious processes going on that thinking about something has no impact upon, and I'll look at that in a moment. And certainly if we live in a soup of negativity, that's not going to do you any good. However, frankly, you would probably deserve everything you got from some of my patients, and a PTSD war soldier, for example, who, should just be told that he should be grateful that he's alive. I understand it was difficult, but, just see the positive in the fact that you're alive and you're breathing right now. Well, that doesn't stop him within 100 milliseconds hitting the deck when he hears a car backfire and have flashbacks and be taken back to horrific moments of his experience. And frankly, it angers me, and it's patronizing, and it's ignorant to suggest that you should be able to think your way out of that. The unconscious processes that take place in the nervous system are not reachable by choosing to think differently. There is a balance. A robust nervous system is one which can cope with all experiences. And our work really is about not being able to be positive about something, because in a way that's a form of denial. If you're dealing with the grief of the fact that your dad's just died, be with the grief. Be with the loss. It's ridiculous and it's patronizing to suggest that someone should just be positive and go, he had a good life. And we must just see the positive in the wonderfulness. Why can you not see that and simultaneously hold the loss? And actually, my experience is, if you don't be with the negative, so-called, if you want to even call it negative, let's not call it negative, they're just painful, difficult emotions. It's just not happy ourselves away. Life has pain in it. And the strongest person is not the one who learns to train their mind to see a positive perspective and spin on things. Now, that's somebody who lives in denial because they can't deal with. What is the strongest nervous system in a way is one that can be with all things. And in a nervous system world, if we build your window of tolerance and your capacity to be with different experiences that don't overwhelm your system, just as the Buddhist said, everything in life is transient. Everything. We are our breath, our life, and every emotion. There isn't a singular emotion that you have stayed with if you allow it to move through. The question is whether you can allow it to be in capacity, or whether we have to try to positive it away. Well, then, in my experience, it just gets buried in the body and will cause disease and illness. So I feel quite strongly and passionately about unhealthy positivity. But similarly, we may need to help people to come out of very negative thinking patterns. That's also true in some depressive states. And to build hope. But you can't just decide to do it. It has to be an experienced thing that we just catch and then go, there we are. Now let's see if we can let that blossom. Yeah. So, positivity. Well, there's positives and negatives.